right, this comes directly from your book, and so many students kept asking me to explain it because they didn't understand this chain link thing that I thought I'd better explain it. What this is, it's showing all the places where potential contamination could occur, okay? Starting up at the top one, causative agent, okay, it starts there. What is the agent? What is the illness? What is the pathogen that's transmitting it to the next place? And those two things you got up there are things that would break that chain from going further, okay? So to keep that causative agent, you need to do early recognition of signs of infection, signs and symptoms. If you see those early, take action, and it will break the chain. Rapid, accurate identification of the organism. Get it to the lab, identify what the issue is, and know what to use to kill it, and you break that chain. If you don't get it there, you go look for a source or a reservoir, a place where it's held up, okay, and growing. What do you use to prevent it there? Medical asepsis. That is good, clean technique where you clean stuff and your countertops and your instruments and everything. You use standard precautions. You treat everybody as if they're potentially contagious. Employee health, keeping them healthy. Environmental sanitation, are the janitors doing their job? Are the air conditioning and cooling systems doing their job? And then of course disinfection, sterilization. If you don't stop it at the top link, you use these items to stop it at the source of the reservoir. If that hasn't stopped it, it goes on to a portal of exit. Now it's leaving that host or that place where it was growing to go to the next person. So how do you stop it at that point? Again, medical asepsis, PPEs, hand washing, control excretions and secretions, manage your waste, your trash and your waste disposal, and then standard precautions. Go to modes of transmission. Use transmission-based precautions, food handling, airflow control. There's the AC units again. Medical asepsis. Somewhere along the line, we hope to stop this chain so it doesn't keep circling through our facility and keep getting people infected. So that's what this is talking about. Portal of entry, somebody's wound isn't covered. If it isn't covered, it could enter the body that way. Catheter care, taking good care of whether it be a blood catheter or a urinal catheter. Medical asepsis again. And then keeping it from ever getting inside of the host, vaccination, immunization, and treatment of the underlying disease. So you sort of understand the diagram now? I got one nod.
Yes.
Okay. Thank you, Ashley. Thank you. That was Ashley Alexander. All right. Bacteria. Basic terms for bacteria. I'm not going to make you learn all these 20-mile names of things. I don't know half of them anymore. And so I've been out of the lab for 25, 30 years. But here are some basics. Bacteria that are rod-shaped are called bacilli. That is in their name somewhere. Da-da-da-da-da-da, bacilli, blah, blah, blah. Okay? So they're rod-shaped. They can be flagellates, which are ones that have flagella. Okay? Or they can be elongated bacilli spores. See, they're still rod-shaped. They're just looped back on one another. Okay? Cocci are round. Staphylococci, micrococci, diplococci, streptococci, all of those are round or spherical in shape. Okay? And here you see when the tube goes around, there's no junction point on those others. I mean, it may look like that one right there is, but as a whole, they kind of go all the way around. Therefore, they're spherical. The other ones were rods, like if you took a balloon and stretched it and touched the parts, you could see where the junction was, and that's why they're still bacilli instead of cocci. Okay? And then the last one is spirilla. Okay? Spirochetes, vibrioids, and spirilla. Parakeet. But again, they're just different types that are spiral in nature. You're hungry still, aren't you? You didn't have enough for lunch. All right? All right. This is just emphasizing that it needs to end somewhere in this chain to keep it from getting spread from person to person to person. There are entire departments in the hospital that this is their job. They prevent nosocomial infection. What is that? Right, where you're passing something within a healthcare facility. Remember that term, nosocomial. That was from a long time ago. Do you remember it? Okay, good. Nosocomial. It's an infection that's transmitted from the healthcare facility to you. If you went in for a broken arm and you caught pneumonia from the hospital, that would be a nosocomial infection. Okay? Yeah? Yeah. But you also sign a release saying that there is a potential for that to occur, and if you sign that release, then you're okay. You're going for the lion look back there. You realize you went like this, and you, okay. All right, that's why I was laughing. All right, things that have special marquees and what they mean within the hospital. Usually yellow means warning, okay? Also yellow means that they have other precautions set in place to keep from spreading things from room to room. Even the gowns that you use in those rooms are yellow. You'll see some of those when we go over the PPEs later. Identification and placement. Of course, you're going to put somebody in a particular room if they have a contagious disease. You don't group them with another patient. You don't put them in a double room. You also may put them in a room that has a vestibule. Okay? Have you ever gone to, well, you probably shouldn't be visiting people like this, but they have a yellow card on the door with all these little marquees that I'm telling you about. And you go in there and there's a small area that's like a small bathroom and sink where you got to put all this junk on and wash up before you can go into the real room. Okay?
What is light?
In a hospital, certain rooms are high isolation rooms. Some have no access, some have limited access with a changing vestibule.
So
and
at the Emory Hospital in Atlanta, they have to do that because they have that.
Yeah, they got Beulah, it's got a major vestibule. The vestibule is its own room and you have to be totally encased from head to toe. But if I was in the normal style isolation room, you got to put on your yellow gown, you got to put on your face mask shields and all that kind of stuff, your gloves. You've got to use disposable instrumentation, so you don't take your big, well, definitely don't open your cell phone in there, but you don't take your big vital signs equipment because you got to throw it away after the patient's out of there. So you take disposable strips that you put in your mouth to take the temperature and you throw them away, or a glass thermometer because they're only like 20 cents. You know, you don't take your $1,200 Welch Allen thermometer in there because you'd have to throw it away. Okay. Then when you finish with the patient, you stop in that vestibule, must take everything that's an external shell off, wash up, and then you can leave the room. Okay? Yeah, you're still sort of in there. You're in a little room off of the main patient's room, cleaning, so you're not carrying anything with you. So isolation, private rooms with engineering controls, that's what I'm talking about. Okay? Wash your hands, proper hand washing. You'll see that in an area. When flu breaks out in the pediatric ward, extra signs about making sure everybody washes their hands a ton of times to keep it from being spread from one room to the next. Linen controls. You may be in an area where, I hate to be gross, y'all, but stomach bug takes over. Patients are vomiting and defecating all over themselves. Okay? Well, you want to have linen controls in place because it definitely could be transmitted through the vomit or the feces in their linens, their bed linens. Okay? So you make sure you have those controls set in place.
Oh, wait.
They're all in your book. Bucket. Hand wash. Okay? It's actually a linens bag in a metal cage. Mask and airborne defenses. Obviously, if you've identified that the pathogen is airborne, you want to make sure that everybody that goes in that room has a mask and goggles. Gowns and barriers. There's that yellow gown PPE that we'll talk about. That area for that patient requires you to put on a gown before you go in there. A lot of pediatric wards that have babies in a high risk area, the mother still has to put on a yellow gown when she goes in there or when the dad goes in there. Gloving precautions, make sure that they're put in place in areas where you're going to be handling a lot of the patient's products. Biohazards and no sheathing. Well, you shouldn't be sheathing in the first place. But make sure that biohazards are identified. Sharps containers are identified, especially in a high-risk room. And they even put additional controls in there. Resuscitation devices. In the old days, like with Camp, when he was born, Ms. Fender has his little mask that they used to bring him around right after he was born. She has it in a memory book. Well, they found out that that had pathogens in it. So no longer are you allowed to carry those home with you. You have to dispose of them. So don't forget about masks for breathing and stuff like that can also transmit. My dad just caught an infection from a CPAP machine, the device she wears when he sleeps to help with sleep apnea. He caught an infection from it because he didn't clean it like he was supposed to. And you can do that in carrying one thing from a patient to another. Don't forget about all these. We've looked at these, the eye wash stations and the showers, and that's it. Okay? Good, I got through with the notes section.